An urgent recall to tell you about tonight. A New Jersey-based medical care and skin care products or manufacturers recalling several types of hand soap, cleanser, antiseptic products because they are contaminated with bacteria. So here to talk about that is Dr. Todd Ellerin, the Chief of Infectious Diseases at Health. It's always great to see you, Dr.
Great to be with you.
Thanks for coming in. So we want to let our viewers know that they can find a list of all recalled products from DermaRite, right?
That's right.
DermaRite. It's on our website, WCVB.com. So there's a list there. You can find that list there. The company says the products are contaminated with a specific type of bacteria. What is it?
The bacteria is called Burkholderia, and it's a group of bacteria that's very hardy. It can picture like a bacteria that can have a little force field around it that can survive things like these antiseptic soaps and gels and hand cleaners. These are over-the-counter products.
That seems antithetical that it could survive it.
It is. It's one of the hardier bacteria, and it can survive in these type of like moist environments.
All right. So let's break it down a little bit. Are there certain groups of people, for example, more susceptible to becoming infected?
Absolutely. Immunocompromised patients and patients with underlying chronic lung disease, like patients with cystic fibrosis. Those are the ones that we generally see. I have seen this, it's still a rare bacteria. I've seen this in patients with cystic fibrosis. It can cause a bad pneumonia. But remember, these are hand products or products on the skin.
Right.
So we'd worry about people with wounds. And again, probably for most people, they'd be asymptomatic, maybe a minor wound. But patients who are immunocompromised, you can have problems. A few years ago, there was an ultrasound gel that was contaminated in 2021, and that affected 56 people, very serious, immunocompromised. So it can cause issues, but so far, there have been no patients affected.
What should people look for, and when is it time to see a doctor?
Yeah, I mean, obviously, if you've been exposed to this product and you have symptoms like fevers or significant what we call cellulitis, spreading redness, or signs of sepsis, high fevers, etc., then you'd want to seek medical attention. I think the important thing here is that the company does quality control. They recognize this, then they disclosed it to the FDA. They posted it just a few days ago, and now it gets to us so we can, prevent people from having it. And if you have these products, then you can discard it.
Always great to see you, Dr. Ellerin. Thank you.
You too.
Take care. Maria?